This is the Berman Method Podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
Mic check 1 2, mic check 1 2, and we're rolling, baby. I hope this works.
Is it going to work?
I think so. It says it's recording.
Okay.
Our SD card exploded. It's been used so many times.
I still don't know how that happened.
I don't know how it happened either, but luckily we've got game cameras all over the yard. So just went out to one of the trusty game cameras and pulled an SD card from there. Hopefully there wasn't any really good deer on there that I just erased.
That'd be a real bummer.
But this podcast is more important than the deer.
I think the deer will probably come back tonight.
But what if they don't?
Welcome to the Berman Method Podcast, where we treat problems and not symptoms. I'm Jenni Berman, physician assistant.
Dr. Jake Berman here.
Awesome.
Good intro.
It is deer season after all.
But seriously, how many times in the 5 years that we've been here have we gotten one animal one time?
That's true. We've had one bobcat, one panther. What else have we had? I mean, we've had
one giant bear.
We've had several bear, though. But I guess one was really giant. Yeah.
Yeah, so hopefully none of those were on this.
A lot of deer.
And hopefully this thing actually records. It says it's recording.
All right. I hope everybody's having a great Monday. This is our Monday.
Yeah, we're rolling with it, though, baby. We're rolling on the Berman Method Podcast. We're David against Goliath. Today's going to be a lot about our reason for being, about how we're all about treating problems and not symptoms, how we're going against the corporate medical system. Because today I want to talk about the value and importance of a second opinion. But before we get into all that stuff, a couple of, public service announcements. Thank you so much for everybody for reaching out and giving us your questions and passing these podcasts along for physical therapists, PTAs, athletic trainers. And we're getting a ton of resumes in from a lot of good candidates. So we're going to be building a really solid team over the next 3 to 6 to 9 months. And it's going to be a lot of fun to see what this thing evolves into, this whole business thing evolves into. Yes.
I'm looking forward to your team growing. Our team has grown a lot over the last couple of months. So it's all for you guys, all for the listeners, all for our clients, that we continue to grow and evolve and help that one more.
It's definitely not for us, right? More headaches.
Yeah, not for me and you. No. We don't do it for me and you. We do it for the fact that we are continuing to have consultations and new clients come in, and our current clients continuing with us, continuing to work with us on a weekly, biweekly, or monthly basis because they see the value in it.
Because we're actually changing lives. And that ties in perfectly to what I wanted to get into, which is the value of getting a second opinion, the importance of getting a second opinion. Because let's use orthopedic surgeries for an example. If you have a knee replacement, a hip replacement, a shoulder surgery, rotator cuff repair, or just like a debridement where they go in and clean it out, or a foot and ankle. Ooh, how about a toe fusion? How many times do we see great toe fusions or bunionectomies, whatever it is? The chances are that you've gone down this route to end up in surgery. Chances are you started having pain, non-traumatic, which means that you just started having pain for no reason. You were not in a car accident. You didn't slip and fall, so there was no trauma. You just blamed it on getting older and you just started feeling some pain. So the first thing you most likely did was go to your primary care physician, which most likely gave you some type of pain medicine or what do you think?
Anti-inflammatory.
Yeah, some type of anti-inflammatory.
And a referral.
And a referral to?
The specialist. The orthopedic doctor.
The orthopedic doctor who specializes in, let's use knee. Knees are the easiest one. So you go to your primary care, they give you some anti-inflammatories, and then give you a referral to go to the orthopedic surgeon who specializes in?
Surgery.
Knee replacements. Yeah. Refers you to the orthopedic surgeon that specializes in knee replacements or surgery. He does x-rays, maybe an MRI, and says, yes, it's bone on bone. We need to cut it off and put some new metal and plastic in there, and you'll be just fine. You take it for what it is on the surface level and say, okay, yep, I guess I'm getting older. Knee replacements are so common in America. I guess it's just my turn. So that's the usual progression of ending up with an orthopedic surgery.
Sure.
Right?
Right.
Now, the problem with all of this is you might not have needed the knee replacement, or you might not have needed it yet.
Right now.
Might not have needed it right now. And the reason why you don't know that is because you didn't go to anybody that specializes in avoiding surgery.
Correct. Rehabilitation, muscle activation. Actually being able to put your hands on you and evaluate you, not just the verbiage of pain plus the x-ray or MRI.
All of that's correct, but let's just keep it on a surface level. Let's keep it on a 5th grade reading level and say, you did not go to anybody that specializes in avoiding surgery. You went to somebody that specializes in administering surgery.
Right.
So you have to understand that the orthopedic surgeon is an expert in surgery. That's what they're an expert in. They went to years and years of school and residency to become an expert in surgery. They are not experts in rehab or prevention. They'll tell you themselves. Whenever they do this is my favorite thing. Drives me nuts how much I love this thing, is where somebody will have a knee replacement. And 3 months, 6 months, 9 months, even 12 months later, that patient is still complaining of knee pain. And they keep going back to the orthopedic surgeon, and he keeps taking x-rays and showing the x-rays to the patient saying, look how perfect my job was. I did my job perfectly. You're just going to have to keep going to rehab.
Right.
Right? How many times does that happen?
Right. Very, very common. Yes.
Over and over again.
Because their pictures look perfect.
Yes, because they specialize in surgery. They're experts in surgery. They're not experts in preventing surgery or recovering from surgery. And they're not going to try to pretend that they are.
Right. And, at the end of the day, this comes back to the fact that your knee pain probably wasn't coming from the joint itself anyways, because their job looks perfect and you're still having pain. So where's the pain coming from?
Exactly. You must understand where the advice is coming from. Here's another example where you and I, Jenni and myself, we're both in the same mastermind group. We're in our separate subgroups, but we're in the same general mastermind group where we go to business meetings every quarter. And then we go to our subgroup business meetings every quarter also. So combined, we're going to 3, 6, 9 meetings a year between the two of us. Mm-hmm. Wait, more than that, because 4 CEO meetings a year. So 4, 8, 9, 10, 11 meetings a year, because there's 3 combined ones. And our mentor, Paul, he cracks me up when he says this. He goes, Whenever you start seeing success and your business starts getting success, the natural thing that starts to occur is you start to get some negative criticism where you'll start to hear some comments from the peanut gallery, for example, on Facebook. Social media is the easiest one to see it. Whenever you start seeing some success, the first place that you'll see it is on social media, where people will start commenting that you're wrong or whatever it is. And then he goes, this makes me laugh every time he says it, because you will never, ever, ever be criticized by somebody that knows more than you, right? You're always criticized by somebody that knows less than you, right? So never, ever listen to somebody critique your ambition towards success who's not successful themselves.
Okay.
Right? So tying it back in full circle to where we're going with this thing is you have to understand who is saying the advice. That's my point of this is everybody has an opinion, right? Everybody's like, it's like assholes and elbows. Everybody's got one, right? So everybody's got an opinion. So you have to understand where it's coming from. So the same thing in your world, where how many times has somebody gone to the doctor for whatever GI issue? Pick one.
Crohn's disease.
Crohn's. Let's use Crohn's. I was going to pick a rash, gator skin.
Eczema.
I was going to pick eczema.
Okay, you said GI issue.
Yeah, so let's use Crohn's. Okay. And you go to the doctor, and what's the first thing they do?
Put you on a medication.
Which one?
Humira.
Okay.
Very common. It may not be the first one for everybody, but very common.
Which doctor do they usually go to first?
Well, after their primary, then they'll go to the gastroenterologist.
Well, let's start with the primary. What are primary care physicians experts in doing?
Giving referrals. Seriously. And when I was in PA school, we were taught you just don't kill the person and then refer. Like as a primary care physician assistant, you were taught make sure they're not dying and refer to the specialist.
That's what I was getting at. Make sure that person does not die in your office or within 24 hours of leaving your office, and make sure you refer them to the right person.
And that's what you're taught as a primary care physician or physician assistant. It's crazy.
Yeah.
That was the running joke in PA school. Just refer. And then, so that shows you, like, you really, to get into a specialty, you really have to educate yourself. You have to go to these mastermind meetings. You have to go to continuing education. Like, that's how you get your specialty and learning your specialty. But anyways, that's besides the point right now. Yeah, the point is referring to the specialist.
Right. So how many people listening to this podcast have been with their primary care physician for years and think that their primary care physician's word is the end all be all? Right? Well, my doctor told me this. Really?
Right.
Did you know that your doctor is really just an expert on not letting you die?
Well, they have to know. So there's the specialists know a lot about a little, right? A lot of information about one little thing or one diagnosis. Primary cares know a little about a lot.
Exactly.
Right? They don't specialize in any individual thing. They don't specialize in any individual medication. They most of the time don't know a ton about the functional medicine aspect or even the functional medicine supplements or medicines that are utilized for certain things. So they know a little bit about a ton of stuff.
Yeah. Jack of all trades, master of none. So I think this is perfect. So the thing that I want to communicate is I'm not shitting on primary care physicians or orthopedic surgeons. I'm not at all.
No, we have to have them.
We have to have them. What I'm trying to communicate here is you just have to understand who the message is coming from. So if somebody's telling you that you have to take pain medicine for your back pain, who is that message coming from? Is it coming from a primary care physician who doesn't know anything significant about orthopedic conditions? Or is it coming from the orthopedic surgeon who is an expert at performing surgery? Or is it coming from a rehab specialist who specializes in helping you avoid surgery or recover from surgery.
Right, right. And the same thing in the functional medicine world is the amount of clients that we have coming to us finally after years of being shifted from one GI doctor to another GI doctor because of their diarrhea, loose stool, constipation, bloating, abdominal pain, or those who finally come to us after years of being treated medically with medications for their rheumatoid arthritis or their multiple sclerosis, and they want to get out of that realm of having to rely on pain medicines and steroids and finally come to us and allow us to look deeper into what is actually causing the problem. Same thing with depression and anxiety. The amount of individuals we've had in the past 2 months come to us with anxiety and they're just sick of being on medications or shifted from one anxiety medicine to another, and they want a different answer. We've dealt with a ton of anxiety lately. Infertility, we've seen a lot of that lately, especially now that I am a certified fertility specialist in functional medicine. We've been seeing a lot of that too. So the answers aren't always going to the specialist and just utilizing the medications that they recommend. In fact, we're on a personal level going through this with Stella right now. We've been dealing with some eating issues with Stella for a year now, some vomiting issues, and she's already gluten-free and dairy-free. We saw the endocrinologist. We were inpatient. We've been to GI doctor. We've been to behavioral therapy. And finally, I came back to her pediatrician, who again is, more general, but I went back to talk to her and I said, okay, we've been to all these different specialists. I'm a little too subjective to be objective in this situation, meaning I'm too close to the situation to think more clearly and on an objective level. So I brainstormed with her pediatrician and we, talked it out about all the different results that we've had. And ultimately, we did food sensitivity testing on Stella and are taking a different approach from the medical world. We know at this point it is not a metabolic error, meaning she's metabolizing. So now we just have to figure out what to do differently for her. So again, we've gone to specialists, but we're coming back to the functional side.
Yeah. To summarize all of this, what I'm trying to communicate is Jake and Jenni do not know everything.
Oh, definitely.
We cannot fix everything, nor do we claim to fix everything. Your orthopedic surgeon, they do not know everything. They can't fix everything. They can't help you avoid surgery as good as Jake can. Your primary care physician, they don't know everything. They know a lot about a lot of things, but they're not going to help you with the nitty-gritty of gut health. The thing that we have to understand is you've got to get multiple opinions. And then one of them is going to really resonate with you. I think that that's another thing that we can translate this back to the business aspect. As you and I continue to grow personally and professionally into this business role and becoming CEOs and really becoming true business owners and running businesses, the more opinions we get, it's really easy nowadays for me to say, yeah, I definitely agree with that, or no, absolutely not, versus even just 5 years ago, because I didn't know what I didn't know, I didn't know if I should agree with this advice or not.
Right.
But it only comes after hearing multiple points of view. I mean, still to this day, I've been with our current mentor for 6-7 years now. And he's my coach, and whatever he tells me to do, I do it because he's already done exactly what I want to do. And if he's already been successful in doing it, why would I try to reinvent the wheel? However, at the same time, I'm still listening to other coaches. I might not be doing what they're suggesting, but I want as much information as I can possibly get so that I can make the best informed decision that I possibly can. What resonates and makes sense best for me? So the same thing for somebody with knee pain. Somebody with knee pain who's 65 years old and watches cable television 2 to 3 hours a day, you're going to think that knee replacements are a normal part of getting old, because that's the normal thing in the media here in America. It's a normal part of aging. But if you go outside of that viewpoint and you actually talk to some specialists who specialize in avoiding surgery altogether, you might get a second opinion or a different perspective.
Right. And it has to be the same thing with us as far as our learning, me and you specifically, and what we're practicing. We learn from others with education, continuing education, other mentors, podcasts that we listen to. And the same thing goes into how we treat our patients, is we listen to all these different things and then have to research a little bit deeper what we're hearing from these different podcasts or mentors and decide what's actually going to be beneficial for our clients and where we want to utilize what we're learning to treat. So the same thing goes with education for us, not just, as the client.
Let me give another specific example, and this one is of an ankle. So one of my clients a couple of weeks ago came to me after going to an orthopedic surgeon that recommended that he have surgery on his ankle. It's his right ankle, because the cartilage is gone and it's excruciating for him to even walk. So after hearing the whole story, I mean, this guy's got a lot going on, but hearing the whole story and taking it into consideration from beginning to end, and then going through and doing some objective testing, so testing muscle strength, what I ended up finding was his left hip was not as strong as his right hip. So super long story short, it's hard to communicate this message through a podcast. When the left hip is not strong enough while you're walking, it forces you to land harder on your right leg. So because the left hip isn't strong enough, when you're swinging your right leg through, it forces you to kind of collapse and land harder on the right foot. Over years, that will force the wear and tear of that ankle joint. So yes, we could go in there and do surgery on that right ankle, and it might fix the immediate acute pain that he's experiencing. However, it'll be a very temporary fix because we didn't address the cause to begin with, which is the left hip weakness. So I said to him, listen, let's just give this a valiant effort. Let's work as hard as we possibly can on strengthening that left hip, because the stronger that left hip is, the less intensity or the less force that's going to be placed on that right ankle. That just might be enough to decrease the inflammation just enough so that the pain response decreases and we can avoid surgery altogether. So it's little things like that where you want to just figure out what's going on. Where is the message coming from? Is it coming from a person who specializes in surgery? Or is it coming from somebody who specializes in looking at the whole picture and really doing some problem solving, which is kind of ironic because going through my grade schools, I always hated the problem solving questions the most.
Same.
Gosh.
But it required reading.
Yeah.
We don't need to read now.
Yeah.
We just need to touch the patient and hear the patient and understand the patient. So that makes it better. Yeah.
Good. What else? You want to say anything else before we wrap up today?
No, I think that's it. Question everything. Even us. We've said that multiple times, but even question us as your provider, if we are your provider, or if you're thinking about it, question us. See if, the information we can provide back to you resonates with you, and ask us why. Why are we thinking that way? Why are we treating this way? Why aren't we doing X, Y, Z? But more importantly, question your providers, dig deeper, look at the problem, not just treating the symptoms.
Exactly. The longer that I'm in this game, the more excited I am when I get questions. So whenever I go out into public, into the country clubs and present my talks and do seminars and workshops in the country clubs, it seems like at least 10% of the time, if not 25% of the time, there's a retired orthopedic surgeon in the crowd, and they can't help but to question what I'm saying. And I love it. Picture me, Jake Berman, standing in front of a crowd of 20, 30, sometimes 50 people, and one guy who's well known and renowned in that community, in the group there, stands up and asks me a question that's contrary to what I'd just been talking about. I absolutely love it. I don't back down at all. I just go toe to toe with them in a respectful way and say, this is how it is now. I understand how it was 20, 30 years ago when you were practicing surgery. However, we're practicing avoiding surgery. Right. And it always ends very respectful. But if I wasn't as confident as I am, not arrogant, but confident, I would back down. I'd tremor in those kind of situations, but I don't.
Right. And research is constantly evolving. And that's the thing, is we are always in reading the latest research, learning the latest. I just this past week had a patient questioning me about my recommendation of thyroid treatment versus what her endocrinologist told her to do. And I'm like, there's nothing against what your endocrinologist is saying, and I'm happy to to follow that path of what endocrinology is recommending. However, with the recent research, this is what it's showing, and this is what's most beneficial to the client. So you have to understand that, again, Western medicine is taught one way, and they're often in that mill of that one way because they are so busy treating so many patients, don't have the time to actually look a little bit deeper into the individual and at the latest research. Whereas in functional medicine or out of network providing like we do, we have the ability to do that. So again, not saying that anybody is wrong, but just know who you're seeing and do they have the ability to dig deeper into your specific body, to do the research on you clinically and get a second opinion. Question what they're doing. Question what we're doing.
Always question. Love it. So let's wrap it up there. Please share this episode. I know that there's some people listening to this who still have a parent who swears that their primary care physician is the end all be all, and whatever they say is the straight from the breath of whoever, right? Mm-hmm. So share this episode with somebody in your family, most likely a parent, who thinks that way. And maybe it'll get them to question, or maybe they'll just question you for saying, why are you listening to that joke? I mean, there's no way that's accurate.
All right. Happy Monday. Hopefully this recorded.
Yeah, that would be nice if it did. All right. Until next time.
Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.